And the Canadian Cancer Society estimates 1 in 8 Canadian women will develop breast cancer during their lifetime. And on average, 83 Canadian women are diagnosed with breast cancer every single day. And that's why the new breast health research unit opening at the IWK is more important than ever. It's made possible by a $2 million donation to the IWK Foundation in Halifax to improve care for women facing breast cancers. So here to tell us more is Dr. Ashley Drohan, a surgeon with the IWK Health Program. Thank you so much for coming in. But specifically, breast health is your area of interest at the IWK. Now, explain exactly what this $2 million is going to do to help women.
So first of all, thanks so much for having me here today. Really excited to be talking about this. And it's difficult to put into words how important this donation is to us as health services researchers, but also to the patients who are diagnosed with breast cancer. Basically, this donation affords us the opportunity to come together now with resources and time and energy to do what we want to do, and that is study patients with breast cancer and really gain understanding on how patients are being treated, what their outcomes are, and identify areas that we could perhaps improve.
Well, there's some interesting stats. Like, I understand that in our region, the numbers aren't great. We actually have a low survival rate if you look at it a certain way. Why don't you explain that for our viewers?
Sure. Yeah, so the Canadian Cancer Society, they measure the number of new cancer diagnoses for several different disease sites, including breast cancer, and they report that on a provincial level every year, and they also measure the number of patients who die of a specific cancer. And so what we know is in 2024 that Nova Scotia had the highest age-standardized mortality rate for breast cancer. So basically what that means is when you compare different populations or provinces across Canada, that Nova Scotia per capita had more patients die of breast cancer than the rest of the country.
Well, that is shocking, and we don't know the answer, right? That's why this research is so important.
Yeah. And that's exactly our mantra, is that now we have the support of the IWK, we have the support of the J&W Murphy Foundation, and we've all come together really with the passion and desire to understand this troubling statistic more and basically provide information for policymakers, decision makers to identify areas to intervene.
So how will you gather the data?
So that's a great question, and the beauty of the Breast Health Research Unit is that we are able to conduct several different studies at the same time. One of our main areas of focus right now is using prospective data. So it means that we will see a patient in clinic, we will talk to them about their breast cancer, but also get information about the patient, get information about their cancer, and then follow them along their cancer journey. And so we want to understand basically how care is delivered from diagnosis all the way to survivorship. And it's just a matter of us seeing the patient and collecting the data.
How long have you been doing this work at the IWK?
So I'm just about at my 2-year anniversary of starting a staff position.
Okay, so relatively new.
Yeah, very exciting. Yeah.
And as you've been doing this work, is it what you expected when you were training to be a medical student? Is this when you're working in the industry? Is it like, oh yeah, this is exactly how I thought it was going to be, or are things surprising you?
I mean, the thing about medical training is it's very long, so 17 years of training. So I really had a lot of opportunity to understand the system. So yes, it's pretty much as expected, but I would say having this kind of support from the IWK and the J&W Murphy Foundation this early on in my career, it's so exciting. Like the difference that we can make, I expected to be a career goal, but now it's happening within the first 5 years.
It's wonderful. And where are we at in the process? Are you already beginning the research now, or is it going to begin soon?
Yeah, so we've already hired a PhD and 2 master-level health services researchers. We already have several projects. Basically, we were ready to go. We had questions to be answered, and now we have the resources and the personnel to do so.
Well, this is very exciting, and congratulations on receiving this money, and best of luck to you and your colleagues in getting this information out, because there are a lot of questions to be answered for sure.
Thank you so much.
All right, that was Dr. Ashley Drohan from the IWK Breast Health Unit. We're going to take a break and be back with more CTV Morning Live right after this.